In the third section of our lecture, Gynecological Problems from Birth to Adolescence, we will talk about some premenarchal disorders. Premenarchal disorders, in this section we will talk about vulvovaginitis, leucorrhea, and also we will talk about neoplasm and vaginal bleeding. First, what is the premenarchal age? It's the age from 5 years to about 12 years of age, and it's the age before the onset of menarche, and menarche is the time when there is onset of the menstrual cycle. So premenarchal is the age from 5 years to about 12 years. The vulvovaginitis is usually vulvovaginitis is common in the premenarchal girls due to lack of low level of circulatory estrogen. Estrogen levels are low in the premenarchal age. So these girls usually they complain of vulvovaginitis. There is redness, there is itching, there is leucorrhea also present. So this is mainly because of low level of estrogen. And decreased level of estrogen cause lack of stratification of vaginal epithelium. So vaginal epithelium is thin. As a result of this thin epithelium, it is more prone to infections. There is lack of glycogen also and absence of daughter line bacillus. There is no acid formation. pH remain high, around 7. So acidity caused the pH level to be less. 7 is the high pH or neutral pH, so pH remains around 7 because of decreased secretion or production of acid. Acid also helps to prevent the infections and prevents the growth of different microorganisms. So all these factors are very common that leads to increased vulvovaginitis in the premenarchal age. Decreased level of estrogen, decreased stratification of vaginal epithelium, decreased production of acid by the daughter line bacillus, and then this can lead to high vaginal pH, which is around 7. The skin, you can see it's red, irritated, swollen also. So patients usually they have girls, they are in miserable condition. They cry because it's very painful, itchy, and there is redness. Even when they micturate or pass urine, they have pain on micturition. Inadequate perineal hygiene is another common reason for vulvovaginitis in premenarchal age. There is lack of protective pubic hair and fatty pad of labia majora. So all these are the common factors that leads to increased incidence of vulvovaginitis in premenarchal age. Causes are usually non-specific, in which we have polymicrobial, different microbia can cause, which are not very specific, polymicrobial. Then we have specific causes of vulvovaginitis are usually non-gonococcal, which includes streptococcus, chlamydia, E. coli, Gardnerella vaginalis, then we have Candida albicans and Trichomonas vaginalis. So among the specific causes, we divided them among non-gonococcal and then gonococcal. Non-gonococcal is Streptococcus, Chlamydia, E. coli, Gardnerella, Candida, and Trichomonas vaginalis. All these are very common non-gonococcal causes of the vulvovaginitis. Then the gonococcus is the another cause of Neisseria gonorrhoeae, which cause vulvovaginitis. Then different foreign bodies can also cause vulvovaginitis. Then we have threadworm infestation, systemic illnesses like infections, measles, chickenpox, diabetes, herpes simplex. All these are common systemic illnesses that can lead to vulvovaginitis, especially diabetes, juvenile diabetes, or the diabetes in the early age. Some antibiotic therapies also leads to vulvovaginitis, and then some skin conditions like lichen sclerosis, psoriasis, all this can lead to eczema and vulvovaginitis. So there is a wide range of causes of vulvovaginitis in premenarchal age. It can be non-specific, then we have specific, which include non-gonococcal, gonococcal, then we have some foreign bodies, some viral infections like measles, chickenpox, juvenile diabetes. All these can lead to vulvovaginitis in premenarchal patients. Some skin conditions like lichen sclerosis, psoriasis, when it is present, it can also affect the vulvovaginal region, and there is dryness of the skin, and it can lead to itching and pruritus, and there are redness of the skin and white scaly skin present. So as a result of these generalized skin conditions, it can affect vulva and vagina also. How we can do the investigations of vulvovaginitis under anesthesia. We can do vaginoscopy, bacteriological examination of the discharge to find out the causative organism, so we can have specific treatment for that. Smear can be obtained from the anal area, stool or blood examination is performed, then we can do tests on urine for protein, sugar, and culture study. So urine culture, and then we can get the specimen from the anus, and then test can be performed on blood and stool. Signs and symptoms of vulvovaginitis. The common symptoms are there is vaginal discharge, there is pruritus, soreness is present, painful urination, and vaginal bleeding. Usually as a result of infection, vaginal bleeding can be present. Then we have different signs there is vulva become edematous or swollen, it becomes red, or ulcers are formed as a result of constant itching. Then there is congested epithelium with discharge, and sometimes there may be foreign body present. So all these are the signs and symptoms. Very commonly there you can see just by looking that there is redness, there are ulcers present, might be foreign body present, or there might be congested epithelium. Management is by treatment can be vulvar hygiene, improve the hygiene. There should be cleaning should be done after urination, and teach the patient that they should take proper hygienic care of the area. Sitz bath is sitting in the warm water sometimes helps, so that's the sitz bath. scrubbing the vulvar area, and keeping the local area dry. So all these are used as a measure for the treatment of the vulvovaginitis. Wear cotton undergarments. Cotton undergarments, usually patients have less allergies to cotton as compared to other materials, so it's better to use cotton underwear. Medications are usually amoxicillin. Estrogen locally as a cream is effective. Then specific therapy is metronidazole for the infections, and then monilial infection we can also use clotrimazole 1% cream. So all metronidazole is used for different fungal infections, and clotrimazole. So all these are the managements we can use. A very effective management is the local hygiene, and then we can try sitz bath, scrubbing, wear cotton undergarments. Some antibiotics might help, and then estrogen treatment. Usually this condition is not very effectively treated by the different drugs, but we can try different things to suit the condition of the patient, because it is really very discomforting condition. Then intramuscular antibiotic therapy can also be tried in serious or severe conditions. Estrogen therapy, and then oral use of albendazole. Leucorrhea, other condition besides the vulvovaginitis, other condition is leucorrhea, which is excessive white, non-offensive and non-irritant discharge per vagina. So leucorrhea is increased white discharge from the vagina, excessive discharge. Due to excessive production of mucus from the cervical glands and increased transudation from the vaginal epithelium. So this is mainly due to increased production of mucus from the cervical gland, and then it is present into the vagina because of transudation from the vaginal epithelium. So abnormal vaginal discharge, we divide it into 4 different subclassification. First is it can be non-infective, then it might be infective, neoplastic, or foreign body. Non-infective, if no infection is present, usually non-infective, they are non-purulent, no pus is present, they are not bad smelling, so non-offensive and non-irritant. Leucorrhea, usually this is due to physiological excess, maybe vaginal cause or cervical cause. So physiological factors, some normal factors can lead to leucorrhea due to increased production just by the cervical or vaginal glands. Then infection can cause a leucorrhea, and when infection causes leucorrhea, usually it is offensive, foul-smelling, irritant, and this can be purulent. Maybe specific causes or non-specific causes. Then we have neoplastic factors that can lead to leucorrhea, and then foreign body can also lead to leucorrhea. This is the neoplasm, another condition. Usually you can see this is the growth coming out of the vagina, and usually ovarian in origin and rarely from cervix and vagina. Neoplasm are not common from cervix or vagina, but they can be present. Malignant, 25% of the cases they are malignant, and germ cell are 70% is germ cell tumors. Granulosa cell tumor is estrogen producing tumor and may cause precocious puberty. So granulosa cell tumor, they produce estrogen, and when there is increased estrogen, it can lead to precocious puberty. We already mentioned in the premenarchal girl, the estrogen level is low. That leads to vulvovaginitis and different conditions. But when the estrogen level is high, it can lead to early puberty, early menarche. So all this is maybe granulosa cell tumor. Then we have mixed germ cell tumor, which is highly malignant, and this germinoma is intermediary in position provided the capsule remains intact. So different types of neoplasm, mainly it's ovarian, but sometimes it's from cervix and vagina. It can be malignant in 25%, germ cell in 70%, and granulosa cell produce estrogen leading to precocious puberty, and that's the naked eye appearance of the neoplasm that's coming out. It can be, the other neoplasm can be sarcoma, botryoides, and then the other condition is vaginal bleeding. Causes of vaginal bleeding can be precocious puberty, or it can be isolated menarche. Precocious puberty is the early onset of puberty that can lead to early menarche and leads to vaginal bleeding. Foreign body in the vagina can lead to bleeding. Any trauma or infection can lead to vaginal bleeding. And then sexual abuse should always be considered if there is vaginal bleeding. Neoplastic conditions can cause to vaginal bleeding. So different things we talked in this section is we talked about vulvovaginitis, we talked about leucorrhea, we talked about neoplasm, and then in this section we are talking about vaginal bleeding. If there is vaginal bleeding before the onset or the age of onset of menarche, we might think that it's precocious puberty, or it can be isolated menarche. Maybe there is some foreign body in the vagina. Sexual abuse should always be considered, or there might be any trauma, infection, or the neoplasm. Also, leech bite. Prolapse of the urethral mucosa. Urethral mucosa, if there is prolapse or bulging out of the urethral mucosa, it can lead to vaginal bleeding. So different factors can lead to vaginal bleeding before the onset of the actual menarche. That was all about the different disorders that can involve the age group before the onset of the menarche. Thank you for watching sqadia.com.